Mic check. Rights to Care press conference. Mic check. Just talking. Mic check. Rights to Care press conference. How does your audio sound? We're just about to get started. Um, I had no breakfast this morning. Yeah.
You have everybody? Is everybody up here? Okay. Wonderful. So we're going to go ahead and get started. Good afternoon. My name is Denise Ferrazzo. I am the Chief Public Health Officer for the City of Detroit Health Department. So happy that you are all here today. This is 2 years in the making. Today, we are launching the Rides to Care service, which provides free rides for moms for prenatal appointments, for families and caregivers for pediatric appointments up until 1 year of the child's birth, and also for moms for postpartum care up to 1 year. So we are announcing a major step forward in removing barriers and improving access to health care for our families. And now the reason why this is important is because infant mortality remains very high in our city. We know that for every 1,000 babies that are born in our city, 14 babies die before their first birthday. We also know that pregnant moms who miss vital appointments, their prenatal and postpartum appointments, they miss out and they experience adverse health outcomes because they can't get to their doctor's appointments because of reliable transportation. And we know that transportation is a social determinant of health. So we are trying to ease the burden for families. So we are launching the Rides to Care service. Now, we also have to address postpartum care because we know that when moms give birth, 21% of them recently have experienced postpartum depression. We don't talk about this enough. So they too will have free rides for their postpartum appointments up until 1 year. Our goal for Rides to Care is to help women, to help families and caregivers reduce transportation challenges so they can get to their doctor's appointments and improve healthcare outcomes. We want to give Detroit babies and moms and families their best chance for a healthy start and to help families thrive. So today you're going to hear how to get the free rides. We have a bunch of wonderful presenters today, but let me first present our mayor, Mike Duggan, who this was part of his vision from years ago. So we're glad to see this come to fruition. So with that, our mayor, Mayor Mike Duggan.
You hear the ads that if you go to high school in the city and you live in the city, you can get free college because you live in Detroit. You hear the ads that we will help you start your business with Motor City Match because you live in Detroit. You hear the ads that we will help you get a job and a career in Detroit at work. And today, we're taking another major step. If you are pregnant or within a year of having the baby, you get a free ride for all of your doctor and medical visits because you live in Detroit. That's what we are doing for Detroit residents. There's a really important reason to do this. Our preterm birth rate is among the highest in the country, which leads to complications for the babies when they're born and not too far after they're born. We have a maternal death rate, the moms, who in some cases weren't healthy to start with and don't take care of themselves, that is far too high. There are many factors that go into it. But nothing can change the trajectory of those numbers faster than going to see your doctor. And if you're in the Detroit area, you have got some of the best OBs and some of the finest high-risk pregnancy doctors anywhere in America. This program covers not just the city of Detroit, but if your doctor is within 5 miles of the city, because we know I have lots of moms whose OBs are in Southfield or are in Warren or are in Dearborn. And so we want to make sure that you can keep going to your same doctor. So this covers trips within 5 miles of the city. Of course, it covers the St. John network over on Moross. It covers the Providence network. A 9 mile, it covers the Corwell network in Dearborn, what we used to call Oakwood on the Dearborn side. All of those networks and a lot of their private OBs are serving Detroit moms. And so this is not a complicated thing to do. We sign a contract with Uber. Uber's really good. You call up, you're going to register with us, so we'll know who you are, we'll know where your doctor is, and this is for doctor appointments. This is not for other things that might be going on in your life. But I don't know how many times I've heard a teenager who's pregnant say, I couldn't get a ride. My mom's car broke down. My friend didn't show up. I didn't want to take the bus to a doctor's appointments. The stories that you're hearing, there are a lot of legitimate barriers. And we want to make sure in the city of Detroit that we are the easiest place that you can be anywhere in America if you're a pregnant mom or you're taking care of that baby in the first year to get to see your doctors. By and large, medical care coverage for pregnant moms and babies is covered. It's covered under Medicaid. It's covered under CHIPS. It's covered under Obamacare. By and large, you're covered. Doctors in this area are taking new patients. You've got some of the finest doctors with the coverage, and now you have a free ride. It is not every place that this happens. In fact, very few places. But in our case, I have the advantage that we got great leadership in Denise Ferrazzo and Dr. Iris Taylor in the health department. We've got great leadership on city council. And there was unanimous support on city council that this was going to be one of the highest priorities in city government. I'm proud to say city council approved this by a unanimous vote. And I would like at this point to introduce their leader, Council President Mary Sheffield.
Good afternoon, everyone, and I am here just to simply say thank you to everyone who was a part of this, to this collaboration and this strong partnership. And I want to also recognize, of course, my colleague, Councilmember Santiago Ramiro, if we can give her a round of applause, who actually chairs Public Health and Safety, where much of this work does go through. But this really warmed my heart to see this program. I could not imagine a family, a youth, a young baby who we have here today who could not get access to an appointment because of lack of transportation. And today it warms my heart to know that we are literally removing barriers to ensure that every youth, every child, every parent, every mother has access to health care to better themselves and their children's lives. And that's what it's all about in Detroit, how we can eliminate barriers. We already know about the disparities that exist in health care and access to appointments and child care in Detroit. And so today is a partnership to remove those barriers and ensure that everyone has access to the treatment and the care that we need. When parents and children do not go to those doctor's appointments, we also know the adverse impacts that it will have on that child's life and that parent to be supportive and to be the best parent that they can be to that child, and for that child to be the best that they can be as they develop as a young person. So it is an honor on the Detroit City Council to support programs of this sort, and to also thank our healthcare institutions in Detroit that do a phenomenal job of providing the best healthcare to our families and our young people in Detroit. So congratulations also to our amazing director for the healthcare department and all of the staff that work so hard day in and day out to ensure the best opportunities for our families here in Detroit. So congratulations and thank you so much.
So as has been previously stated, we're excited because this is another example of the city's commitment to ensure that people have an opportunity to thrive. So let's talk about how this works. Who's eligible? Any pregnant individual who lives in the city of Detroit. Any person who is a caregiver of an infant up to the age of 1 year. And every woman during their postpartum period has an opportunity to be eligible for this program. So what kind of visits qualify? Again, all of your prenatal care qualifies. All of the infant care up to 1 year qualifies. And all of your postpartum visits up to 1 year post your delivery qualifies. Now, how does it work? Relatively simple. You can call and schedule a ride up to 1 hour before your appointment or 1 week prior to your appointment. You simply dial area code 313-876-0000. Just that simple. And then we will schedule your ride and your return. And we will be able to track you for safety to ensure that your ride is covered. So again, to be eligible, live in the city of Detroit. Be pregnant or be during your postpartum period, or be a guardian or anyone who is caring for an infant up to the age of 1 year. We will take you to your prenatal visits, we will take you to your postpartum visits, and we will take your child to 1 year of their visits. And dial area code 313-876-0000, and you'll be connected. And now it's my pleasure to introduce the chief, the DMC chief of OBGYN, Dr. Bryant.
Thank you so much. I am so honored to be here, to be part of the launch of this program. It's even easier. You don't even have to remember the phone number. The posters have a QR code, right? Anybody under 21 that's what they're going to go to, right? So, but thanks again. This is an amazing opportunity. Welcome to our home here at MAC, Wayne Health, and Wayne Pediatrics. I think it says a lot about the character of a city and the character of its leaders when we support and care for those who are among the most vulnerable in the city's population. And it's an investment that time over time has been proven to be worthwhile and to be empowering and to allow all Detroiters the opportunity to have the health care that is their right and what they deserve, and to have the best care. And I appreciate Mayor Duggan's compliments of the healthcare systems in the city. They are great. They are very strong. But the key is to link those services that we provide with patients. And this type of a program that I think is very innovative, and it responds to a very poignant need in this city, and that is to get transportation, to get to your visits. You know, all of the wonderful midwives and nurse practitioners and nurses and doctors here, we can't interact in a positive way with our patients if everybody's not present. So for that, I am very, very grateful. Prenatal care is critical. It is not necessarily interventional, but it is a way for prenatal care providers to identify potential things that come up before they blow up and before people are seriously injured or seriously ill. And that's the benefit. And I think that it goes without saying, and I'm sure we're going to hear how valuable it is for an infant to have excellent infant care in that first year of life. It's critical. And the city and the health department, I want to thank all of them again for providing this. And I'll tell you, I'm a high-risk OB/GYN, and I do high-risk OB, and I can tell you we've already used this program in our office. We already have the posters. If you go upstairs, we're on the second floor. Patients can scan, and we've already had patients that have accessed care with this program. And again, thank you. It's my pleasure to introduce a colleague, Dr. Lynn Smitherman from Wayne Pediatrics.
Good afternoon. When I first heard about this program, I said, wow, this is just absolutely amazing. You know, last year, 7,939 children were born in Detroit. 15% of those were low birth weight, compared to 8.6% nationally. 19% were born prematurely, compared to 10% nationally. And in addition, as was mentioned before, the infant mortality rate in Detroit in 2022 was 14 per 1,000 live births. And the infant mortality rate for Black infants in Detroit is 3 times higher than for white infants. We've got some work to do. That said, programs such as this, supporting pregnant women and new mothers, can make a change for the better for our citizens and our children. During the first year of life, we closely monitor each child's growth and development, partner with parents in promoting child safety, and caring for their children when they become ill. Last week alone, I had 2 newborns cancel their appointments because they didn't have transportation. I am so happy that this program is here. Thank you so much for starting this, Mayor and the Detroit Department of Health. And now back to you, Denise.
Thank you, and thanks to our speakers so far. So we launched this program just about 2 weeks ago, and so far we've booked over 50 rides. And there have been numerous stories that we've heard so far. But there are 2 that really warmed our heart. And so now let's hear from our Rides to Care mothers, first Tamia and then Anastasia. They'll tell you a little bit about their experience with the Rides to Care program. So, Tamia?
Hi. My experience with Rides to Care has been amazing. When I first got introduced to the program, I was kind of like a wreck. I was struggling. I was in a shelter, and a friend introduced me to Miss Stephanie, if I can say, her name. A friend introduced me to Miss Stephanie, and Miss Stephanie introduced me to the program. And ever since she introduced me to the program, I have not had not a worry. I let her know everything, and she gets it done. It's amazing. I've used it for my firstborn, and I'm using it for my secondborn. I absolutely love it. And everything is organized. It lets you know what time, how far away. You never have to worry about being late. It just gets it done for you, and I absolutely love the program. And 10 out of 10 recommend to all the women. 10 out of 10 recommend to all the mothers that don't have transportation, don't have a car right now. It's amazing, and it just takes everything, all the problems away.
Hi, my name is Anastasia Lewis, and I'm here to tell you about my experience with the health department rides. I've been doing them since I was about 7 months pregnant. They helped me get to my OGBY appointments to check up on my baby. And since I haven't had her, I haven't missed any appointments. I get to them all on time. And they're going to tell you when it's coming. They'll give you a call when it's 5 minutes away or 30 minutes before your appointment or when your lift's coming. And I feel like everybody should join it who's struggling or just need help, because right now I'm only 18 and I don't have a job. Well, I do, but it's training right now. And I don't have a car yet, and I don't know how to drive, so I feel like this is a good experience for me. But I'm going to get there. I'm going to learn how to drive. I'm not going to be one of them moms that's not going to drive at all. But this is good right now to help me and not stress out. It's a good village, and it's helping everybody right now, I think.
Okay, so with that, if you are a mom, if you are expectant mom, if you're a caregiver, if you have a little one, and also if you need to get a ride for any of your doctor's appointments, please call us today, 313-876-1000. You can call Monday through Friday from 8 until 6, and then also on Saturdays from 8 o'clock until 2. And with that, we will open it up for any questions.
What are we doing? Gary, what are we doing in order to, a press conference on one day is great, but what are we doing beyond that to make sure communities know and, that the black press, Mr. Mayor, I know y'all got a problem with it, but the black press is a intimate part of our community, and you seem to be neglecting that part.
We have an amazing team of outreach coordinators that are spending their days going to doctors' offices. In fact, in the last 2 weeks, we've gone to about 20 providers. We're sitting down with the clinical managers, with the medical assistants, with the physicians, talking about the importance of this program. We even came here, I think Wayne Health was one of our first stops, and we're telling them about the program, but they're also sharing it with their patients. So that's one of the ways that we are telling folks about this program. We also are rolling out our social media campaign. You'll see reels, you'll see patient testimonials, and we also will have billboards. We're happy to sit down with you and partner on how we can communicate this even broader than we already have. Thank you.
Hey, Bryce Huffman, Bridge Detroit here. You had mentioned that the program launched about 2 weeks ago. I was just wondering, when did the idea first come about? Whose idea was it? Some of that background info, how much work went into making sure that this launched?
We have been doing this at the health department going back to about 2018, 2019, when Dr. Jonee Caldoun was here. We got it launched really well. And then COVID hit, and nobody was transporting anybody. Nobody was getting into a car. What this leadership team had to do was basically rebuild the program from scratch. But it's something that's been important to me. So you go back 12 years, I worked across the street running the Detroit Medical Center. The president of Hutzel Hospital was Dr. Iris Taylor. We would see at Hutzel 500 babies a year delivered at 2 pounds or less. Babies you literally could hold in the palm of your hands. And too often the moms would show up in the emergency room and hadn't been to their prenatal visit. And Iris and I would talk about this all the time. We have all these great doctors. And the patients in our community aren't taking advantage of them. Why doesn't somebody out there do something about transportation? So we have been at this for a number of times. You've heard some folks talk about their experience before, because we're running it in a limited way through Sister Friends and some others before. But with the support of City Council now, we decided we're going to make a major financial commitment and make this simple. You live in Detroit, you're pregnant, or you've delivered in the last year, you got a baby under 1 year, you call the number, we book your ride there, we book your ride back. You can get to some of the best doctors in the world with no problem. And my sidekick here, who ran Hutzel for how long?
I was in the medical center for 40 years.
She can even tell you better than I can how long we've been talking about this. Go ahead, Ira.
Mr. Mayor, while you're at the podium, the wraparound services, all of us who are in the community have had to help somebody. I had to help somebody 2 weeks ago. What are we doing about it? And I don't want us to keep blaming everything mental, but I had a young lady who I had to let in my house with a baby because she was fighting with her family. But what are we doing about wraparound services, about a lot of these young girls who just don't have what we had, mothers and fathers? And I really hated when I had to turn around and had her in my house, and y'all know how much I travel, and not know what would happen. But where are the wraparound services?
Yeah. So you've got, fortunately, a new director of the mental health system who I think you should direct those kinds of questions to. But I want to be clear on what we're doing and what we're not doing. What we're announcing today is if you have trouble getting to your doctor's appointment, you have a ride because you live in the city of Detroit. That's the message today, and we don't want to confuse that message. And I do want to ask, again, Dr. Taylor can talk about her experience running Hutzel Hospital and what she saw from patients who didn't have access to rides.
Frequently, residents have to prioritize their health with everything else that's going on in their lives. And so frequently, as opposed to going to prenatal services, the emergency room is their prenatal care. And as a result of that, at the time when the baby is born, there are not only challenges for the infant, there's also challenges in managing the mother, whether it happens to be hemorrhaging or any of the other complications that are preventable. So the challenge has always been, can we get to a state where we do not have any preventable fatalities for either the mom or the babies? And that has always been our challenge.
Whoever wants to take this. So I think you mentioned earlier there's a list of networks that people can go to for this service. Is there like a specific list?
Yeah, so all you have to do is call. So pick up the phone, dial 313-876-000, and then we would like to know where we're picking you up and where you are going. We have a list of all the providers so that we can make sure the appointments have been arranged appropriately. But I want to say it's over about 100 different clinics within the city as well as the 5-mile radius.
Basically, anybody within 5 miles of the city border. It's not specialized folks. If you're obese in Sterling Heights, we don't cover you on this program, but most of great majority of our patients and our moms are within 5 miles of the city border.
Okay, and I just have a couple more questions. So we had reported that in 2019 there were 11 deaths for every 1,000 births, and did you mention 14 earlier?
So that's the recent data from 2022. For every 1,000 live births in the city of Detroit, 14 babies don't make it to their first birthday, and that is, a definition of infant mortality when you don't make it past your first birthday. And that's the reason why we are here, because 14 babies is way too many in the city of Detroit. And also my colleague also mentioned that that's 3 times higher than it is for white babies, and that is not okay. And so we are trying to make sure that we reduce these challenges and make sure that our families have access to care.
So I understand that transportation is the big hindrance here. At what point did city officials recognize that this was an issue, knowing that this has been a long-standing issue for many years?
Again, we can write a book on this. If you look at but you're right, the 2019 numbers, it was following our first year of running transportation system, and we saw preterm birth and infant mortality drop for the first time. And in March of 2020, it shut down. Nobody was driving people in their cars, and no pregnant women were getting into cars with strangers. And for 2 or 3 years, it was completely shut down. And so you've got Shirley Gray in the back, who through the Sister Friends, we've done individual cases, but to launch it completely is something we've been working on for the last 18 months. And it's a major logistical thing to figure out who's going to answer the telephone. Who's going to sign the contract with Uber? Who's going to follow up with the quality? Who's going to track the mom to make sure if the appointment runs late, we get the ride pushed back so they're still there? It's a pretty major operation, and we have been doing it on a limited basis, and now we're basically doing it on an unlimited basis. And we'll see over the next year or two, you're going to be able to measure the impact. Now, you got a lot of other programs. I have a family member who's running the SOS network, which is phenomenal, that deals with the quality of care at these offices. But at least in the city of Detroit now, we've solved the most basic transportation problem.
Mr. Mayor, did you say that it's in Detroit, it's 5
Right.
miles outside of
Sorry.
Detroit?
So if I were to ask, I don't know where your are your doctors in the city or are they somewhere nearby? Yours-
I go to Hudson.
You both go to Hudson. You brought your own patients. You will find a lot of moms in this town are seeing an OB at 9 Mile, 10 Mile, 11 Mile, or in Dearborn. And so we didn't want to say to the moms, if your OB is outside the city, we're not serving you. So we drew the boundary at 5 miles, and I think that'll pick up 90% plus of the pregnant.
How long is the contract with Uber? How long is this gonna last?
What is it? A 2-year contract, and if we have the impact that we think we're going to have, nobody will ever let it lapse.
You mentioned that you put a big financial commitment to this program. Just wondering what numbers you could share.
Go ahead. Yeah.
So between Uber Health and our call center, it's 1.2 million.
All right.
Any other questions?
Thank you all
Okay,
very much.
thank you.
Well, thank you. You two were terrific.